Hi, I'm Stacey Kilps. I'm one of the neuromuscular therapists here at Function Thru Fitness, and we're going to be answering some common questions that people might have about neuromuscular therapy.
What is NMT and how is it different from massage?
Neuromuscular therapy is really a methodology, not so much a technique or modality. And what it does is looks at different assessments that might be postural, that might be range of motion, and many other potential assessments that help us ascertain where the cause of a symptom might be, because the pain is very rarely where the problem is. And massage therapy tends to be disrobed in a table, face up, face down, more of a general treatment where there's gliding and not a lot of stopping on particular spots necessarily or assessment involved. And in neuromuscular therapy, you rarely, if ever, take clothes off. We might go underneath clothes once in a while to get to the skin in order to do more of a fascial work, which would be on the skin and using the skin as a handle to move things underneath, but you're never fully disrobed. So clothes on, assessment, and there's also a much stronger partnership with the client so that we're asking a lot of questions about what makes things worse, what makes things better, and then giving home care to connect the sessions so that people have some authority over their pain issues or their symptoms if it isn't necessarily pain.
Great. Would you mind demoing for us on Kim?
No, I wouldn't mind. Would you lay on your back? So Kim tends to struggle with her thumbs because she's on the computer a lot. So we often are working in the forearm to affect the thumb and or the back of the forearm. And then often that isn't where it's stemming from. Often it's stemming from higher up the chain. So either the bicep, the tricep, or up in the shoulder somewhere, potentially up into the neck as well. So one particular muscle is called the pronator teres, which comes from the inside of the elbow and goes across the forearm here. And since when you're typing and mousing, you're in what we call a pronated position, palm down position. When we find that muscle, it often is quite interesting and tender. And you don't need a lot of pressure to get the response that you're looking for, which is generally tenderness or potentially trigger points. So if I press here and she feels it in her wrist, for example, or if I press here and she feels it in her elbow, yeah, that's very flippy. Yeah, that usually means that there are adhesions, things are glued together, is the best way to describe that. And so as I treat the pronator, that allows her arm to more naturally be in a neutral position instead of being stuck in a pronated position.